Hi, I'm Dr.Shkre. I'm the prosthodontist here in Northern Cross Dental. In this video, I would like to talk to you about a really interesting case that we have here in Northern Cross Dental. This case is Jenna. Jenna, she came to us with an impacted permanent tooth in her palate. This tooth causes the severe impaction. It has been extracted, and that left Jenna with a missing permanent tooth. Jenna, in her first presentation to the practice, she has severe malalignment in her teeth. Decided to align the other permanent teeth to the position of the missing natural tooth on the front, avoiding to have a denture in such a young patient or implant, which is not possible because of her active growth, and the implant cannot be placed in such a young patient. The treatment option here is to move the adjacent natural teeth to the position of the missing tooth. And as you know, the natural teeth are strong and will allow us to build a composite on it later on. You will see later on this video. Usually, those kind of patients, when they are last stage of their orthodontic treatment or braces treatment, we discuss the space distribution and where the teeth need to be positioned to end up with a nice result. So this girl, as you can see here, there is space between the two front teeth, and this tooth here is small as well. This tooth, right, is a premolar tooth. It is not a canine, so we have to change all of the teeth with composite bonding. So what we did, we had scanned here with the 3D scanner, and with the aid of the digital smile design, we designed her front teeth in the way they need to be. That was according to what she has in the bottom teeth, as you can see here. So from all sides, you can see the teeth are in contact, as we care about the function as well, not only the aesthetic. So this patient, she's one of the daily patients. So me and Kiran sit and discuss the treatment together when she was under active orthodontic treatment. We discussed how the case needs to be finished and how the space and the teeth position and the distribution need to be done, and that was done under one roof, which is so convenient for the patient. Style of treatment, it has the advantage of non-invasive treatment, can be done in one visit. There is no teeth shaping. Sometimes we don't have even to give local aesthetic to the patient. This treatment actually provides the teeth aesthetic, function, shape, and provide the smile.
This blue material is phosphoric acid etching. This is left on the tooth for 15 to 20 seconds, and then the tooth is washed and dried out. This is to create small pores on the tooth surface, so it's ready for the bonding agent to be applied. Plastic strips are placed in between the teeth to protect the adjacent teeth from the bonding agent that is being added.
We use something called silicone index or a guide. From that silicone guide, we can know exactly the teeth shape.
Here, Dr. Shkre is using a guide to create a lingual wall of the tooth. He then uses this flat-ended instrument to create the shape of the tooth. Dr. Shkre adds different shades of composite to the tooth. He adds darker shades in the centre of the tooth and lighter on the outsides. Here, Shkre is measuring the teeth to ensure he is building up the teeth with the correct dimensions as he goes through the composite bonding method.
Use the layering technique, where the composite it's built as a house, like we build the foundation first, then we layer the rest of the composite with different colors and stains. We take care of the teeth width and shape and the line angles, the teeth position, because all details they will reflect when you look at the patient and when the light reflects on them. This treatment also resulted in a little adjustment on the adjacent teeth around the space. So again, good planning, good interpretation of all information, the x-rays, the scans that we got initially on her presentation resulted in a nice outcome of the patient. Now this girl, as I said, she is in teenager age. So in the future, she will come back to us as she's still in growth. So in the future, the alternative option for her can get composite bonding again. However, we will recommend for her porcelain veneer as well because of the advantage of the porcelain versus composite in terms of the material difference and strength as well.
Each layer needs to be accurately cured and set, otherwise this can lead to cracks in the bonding, which will create stronger staining on the teeth. Shkre adds translucency to the edges of the teeth and line angles to mimic the appearance of a natural tooth, where the light hits the tooth surface and reflects in different ways. How the composite bonding is placed on the teeth will determine how long it lasts and how it will look after a few years. Composite bonding is a porous resin, so drinking things like tea or black coffee, red wine or smoking will stain the composite bonding.
Once we finish the treatment, we recommend to the patient avoid, the habits like nail biting or pen biting. This material can absorb stains in the long term, so they need to take care of the regular cleaning aid like dental flossing, brushing, and keep regular appointments every 6 months and 3 months with the hygienist and the dentist, just to keep the teeth clean and well maintained as well. Because the composite bonding, at the end of the day, it is it's a plastic material, so it is subjected to fracture with heavy clinching force or heavy food or unusual habits, I'd say. Thank you. So when the patient they come back for a review in 3 or 6 months, if we found that the composite need to be polished or enhanced, we will do that as well. If there is any rough points or any spots need to be enhanced, that can be done on the review appointments as well. We give the instruction to the patient to use here orthodontic retainer and to clean between the teeth same as normal teeth, and keep the 6 months review with dentist.